Chapter 4, Sample Collection, Blood Sampling Equipment. At the end of this training, the learner should be able to list out various types of equipment necessary to perform a venipuncture, understand about the blood sampling or phlebotomy equipment and its components, understand the applications of phlebotomy equipment. Blood sampling systems can be of two types, open and closed. Closed or evacuated systems for blood sampling are preferable because they have been proven to be safer than open systems and provide better specimen quality. The added advantage of using closed system is that blood comes directly in contact with the anticoagulant, avoiding many pre-analytical issues such as microclot formation. They also reduce the risk of direct exposure to blood and make it easy to take multiple samples from a single venipuncture. Although vacuum extraction systems are safe, training and skill is required for their correct use. Double ended needles are available in several recommended gauge sizes. A thread separates the two ends of the needle. It is where the holder is screwed into place. Open systems include hypodermic needle and syringes and sample container. Sometimes winged steel needles attached to a syringe may be used in place of hypodermic needles. The use of a hypodermic needle and syringe is the most common means of blood sampling. Equipments needed for a routine venipuncture are gloves, needle, tourniquet, alcohol wipes, needle holders, evacuated collection tubes, dry cotton, adhesive bandages or tape, hand sanitizer or alcohol based hand rubs, 1% sodium hypochlorite as disinfectant, puncture proof container for sharps, and finally, biomedical waste color coded bins. Gloves, an important part of personal protective equipment. Disposable gloves are thin, single use gloves, generally 4 to 8 millimeters thick, compared to the reusable ones, which are 18 to 28 millimeters thick. Disposable gloves are not suitable for handling aggressive or highly hazardous chemicals and should never be reused. Disposable gloves can provide barrier protection where contact with chemicals is not likely. Before removing reusable gloves, thoroughly rinse them off and then allow them to dry. Inspect reusable gloves before each use for discoloration, cracking at flexion points, or damage. Discard if discovered. If you suspect they have become contaminated, bag them for disposal as hazardous waste. Gloves can be made of butyl, nitrile, polyvinyl chloride, or natural rubber or latex. Butyl material provides good resistance to aldehydes, ketones, and esters. Nitrile material provides wide range of applications with puncture and abrasion resistance. Polyvinyl chloride resists acids and caustics but not organic solvents. They are too loose fitting for sensitivity required to palpate veins and may not provide adequate barrier to viruses. Natural rubber, latex, minimum chemical resistance, often combined with other materials for a broad range of applications. Latex allergies limit widespread use, it is most commonly used otherwise. Steps of removing gloves without contaminating oneself. Step 1. Pinch and hold the outside of the glove near the wrist area. Step 2. Peel downwards away from the wrist, turning the glove inside out. Step 3. Pull the glove away until it is removed from the hand, holding the inside out glove with the gloved hand. Step 4. With your own ungloved hand, slide your finger under the wrist of the remaining glove. Do not touch the outer surface of the glove. Step 5. Peel downwards away from the wrist, turning the glove inside out. Step 6. Continue to pull the glove down and over the inside out glove, being held in your gloved hand. A tourniquet is a constricting or compressing device used to control arterial and venous blood flow to a portion of an extremity for a period of time. Pressure is applied circumferentially around a portion of a limb at a desired location. This pressure is transferred to the walls of blood vessels, causing them to become temporarily occluded or restricted. Application of tourniquet makes the veins easier to locate and feel for sample collection. Apply the tourniquet within 3-inch clearance above the planned puncture site. Ideally, it should not be applied for longer than a minute at a time. Needles and syringes. Regular or flash needles are more common in use as the phlebotomist gets flash of blood in the hub of the needle the moment it enters the vein, which gives him the confidence. To use a needle and syringe system, open the packaging of the hypodermic needle from the hub end, keeping it capped. Open the sterile packaging of the syringe from the plunger end, keeping the nozzle protected in packaging. Carefully remove the syringe from the packaging and insert the nozzle of the syringe firmly into the exposed hub of the capped hypodermic needle. The parts of a syringe, as shown in the picture, are luer lock, the seal, the barrel which forms the main body of the syringe, the barrel flange, the plunger, and the plunger flange. Choice of gauge for needles. If the needle is too large for the vein for which it is intended, it will tear the vein and cause bleeding or hematoma. If the needle is too large, blood enters the tube faster and forcefully and may result in hemolysis. If the needle is too small, it will damage the blood cells during sampling, and lab tests that require whole blood cells and tests such as potassium, bilirubin, LDH, etc., that get affected due to hemolysis will be invalid. This is a table showing the recommended needle gauge, length and device for phlebotomy procedures for different age groups. How to prevent needle stick injuries. Never disassemble an exposed, used needle with your bare hands. The proper method to be followed is Step 1. Place the cap on a flat surface. Step 2. With one hand, use the needle to scoop up the cap. Step 3. Use the other hand to secure the cap. This is also known as the one hand scoop technique. Always discard the needle holder and syringe as a single entity. Alternatively, one could use holders with a built-in mechanism to release the needle by pressing a button, thus eliminating the need for recapping it. Some systems have a mechanism that can be activated once the needle has been. The mechanism either retracts the used needle into the barrel or snaps it shut or employs a safety shield on the needle. Vacuum systems may also be used with a winged butterfly needle and lure lock connectors. About needle holders. Needle holders are clear and are molded to a standard shape. Wings or extensions at the side of the tube end of the holder act as a lever against which the finger or the thumb can exert pressure to pop on or remove the evacuated tubes while continuing to hold the needle steady within the patient's vein. A major advantage of using holders is the reduced risk of accidental needle stick injury by protecting the blood collector from the non patient needle. Disposable holders with needle attached are disposed of as one unit. Large sharp containers may be required to accommodate disposable holders. Alcohol wipes. Alcohols are effective disinfectants. They evaporate quickly without leaving a residue. Isopropyl alcohol is also known as isopropanol or 2-propanol or rubbing alcohol. Used as disinfectants at a concentration of 70% in water because higher concentrations evaporate too quickly and lower concentrations are not as effective. Always cleanse venipuncture site with 70% isopropyl alcohol swabs. Benefits of alcohol wipes. Widely used as an antiseptic, 70% isopropyl alcohol, when applied directly, reduces the levels of microorganisms on the skin and any other surface. It is proven effective in killing most bacteria, some fungi, and viruses. also used as a mild counter irritant, and a rubifacient, that is a cooling effect on skin. It is indispensable first aid tool and antiseptic aid for clinics and hospitals, first line of intervention for any type of injury. Isopropanol is the primary ingredient in rubbing alcohol and also the main component of hand sanitizers and various disinfectant products. Sodium hypochlorite, also commonly known as bleach. It is a broad spectrum disinfectant effective for the disinfection of viruses, bacteria, fungi, and mycobacterium. For biological waste containing a high organic load, for example, blood, proteins, or lipids, the appropriate concentration of sodium hypochlorite is 1%. Therefore, a 1 is to 5 volume by volume dilution of bleach to liquid biological waste is appropriate. Minimum contact time required for surface disinfection is 1 minute and for liquid waste disinfection is 20 minutes. Bandages and gauze pads. Check puncture site to ascertain if bleeding has stopped completely. Apply sterile gauze pads or bandages on the puncture site. Thus, before starting with venipuncture in a patient, always ensure that all phlebotomy supplies we discussed must be ready for your use at one place.